If you are trying to get sober or even just thinking about getting sober, you may already know that the hard part is not always the substance itself. Yes, cravings are hard. Yes, habits are hard. Yes, being around people who still drink or use can be hard. But a lot of the time, the hardest part of sobriety is what shows up when you are no longer drunk, high, numb, distracted, or checked out. That is the part people do not always talk about. Because when you stop using, you do not just stop a behavior. You also remove a coping tool. Maybe it was not a healthy coping tool. Maybe it caused problems. Maybe it hurt you and hurt people around you. But it may still have been doing something for you. That does not mean it was good for you. It means it had a purpose. And if you do not understand what that purpose was, sobriety can feel confusing. You might think, why is this so hard? Why do I want to go back to something that was ruining my life? Why do I miss something that made me feel so bad? That does not mean you are weak. It means your brain and body got used to using something outside of you to change how you feel inside. So in this video, I want to talk about why sobriety can feel so hard, especially when addiction is connected to pain, stress, childhood mental health, family patterns, or just years of not knowing how to sit with yourself. This is not about making excuses. It is not about blaming your childhood for everything. It is not about saying you have no responsibility. It is about understanding yourself better, because understanding gives you more control. Shame usually does not give people more control. It just makes them hide. So let's start with a simple question. What were you using for? Not what were you using. What were you using for? Because those are different questions. One person may drink because they feel anxious around people. Another person may get high because their mind never slows down. Someone else may take pills because they cannot sleep. Someone else may use because they feel empty, bored, angry, lonely, overwhelmed, or ashamed. Someone else may not even know why. They may only know that being sober feels uncomfortable. That discomfort matters. It is information. A lot of people think addiction is only about wanting pleasure, and sometimes pleasure is part of it. But a lot of addiction is also about relief. Relief from anxiety, relief from depression, relief from memories, relief from pressure, relief from guilt, relief from the feeling that you are never enough, relief from being stuck in your own head, relief from being stuck in your own body. When you look, the question becomes less about why would I do this, and more about what was I trying to get away from. That question can be uncomfortable, but it is useful. Because if you were using to escape anxiety, then sobriety has to include learning how to handle anxiety. If you were using to escape depression, then sobriety has to include taking depression seriously. If you were using to escape trauma, then sobriety has to include support for trauma. If you were using to escape loneliness, then sobriety has to include connection. If you were using because you never learned how to calm yourself down, then sobriety has to include learning those skills. Stopping the substance matters, but if you stop the substance and never look at what was underneath it, you may feel like you are just white-knuckling every day, and white-knuckling is exhausting. That is why it helps to look back. For some people, addiction has roots in childhood. That does not mean every person with addiction had a horrible childhood. It does not mean you have to search for some dramatic memory. It just means childhood teaches us how to deal with pain, stress, emotions, conflict, pressure, and comfort. Some people grew up in homes where feelings were not safe. Maybe you cried and were told you were being dramatic. Maybe you were angry and got punished instead of helped. Maybe you were scared and nobody really noticed. Maybe you were sad and people acted like you were being ungrateful. Maybe the adults around you were dealing with their own problems, so your emotional needs got pushed aside. Or maybe your childhood looked fine from the outside, but inside you felt a lot of pressure. Pressure to get good grades. Pressure to be good at sports. Pressure to make your family proud. Pressure to be the mature one. Pressure to be the responsible one. Pressure to never mess up. Pressure to keep performing, even when you were tired. Some kids grow up feeling like love is connected to achievement. They feel accepted when they succeed. They feel like a problem when they struggle. They learn to push through everything. They learn to ignore their own stress. They learn to act fine. Then later in life, They find something that finally makes the pressure stop for a while. That might be alcohol. It might be weed. It might be pills. It might be something else. But the pattern is similar. The substance gives a break. For a little while, you do not have to be perfect. For a little while, you do not have to think. For a little while, you do not have to feel the pressure in your chest. For a little while, you can relax. The problem is that the break does not stay free. Eventually, it starts costing you. Your sleep gets worse. Your relationships get harder. Your mood gets lower. Your body feels worse. Your confidence drops. Your shame grows. Your problems get delayed, not solved. And then you may use again because now you are not only dealing with the original pain, you are also dealing with the consequences of using. That is how the cycle gets strong. Pain leads to using. Using leads to consequences. Consequences lead to shame. Shame leads to more pain. More pain leads to more using. And then you start thinking the problem is you. But the problem is the cycle, and cycles can be interrupted. One way to interrupt it is to stop asking only, how do I stop? That question matters, but it is not the only question. Also ask what happens right before I want to use. That is where a lot of the answers are. Do you want to use after a fight? After work? When you are alone? When you feel rejected? When you are bored? When you have money? When you feel like you failed? When you feel like you succeeded and now you can celebrate? When you see certain people? When you are in certain places? When you are tired? When you are overstimulated? When you remember something? When you feel like nobody understands you? Those patterns are not random. They show you what your triggers are. And a trigger is not just a word people throw around. A trigger is something that activates the urge to escape. Sometimes it is obvious. Sometimes it is subtle. You may think you are craving the substance, but you might actually be craving a change in how you feel. You might be craving calm. You might be craving confidence. You might be craving silence. You might be craving relief. You might be craving a way to stop caring for a few hours. That is important to know, because if you only fight the craving without meeting the need underneath it, the craving can feel huge. For example, if you use because you are anxious, then you need tools for anxiety. That might mean therapy. It might mean breathing exercises. It might mean walking. It might mean medication from a doctor. It might mean cutting back on caffeine. It might mean leaving situations that keep your nervous system constantly on edge. It might mean learning how to talk to yourself differently. If you use because you are depressed, then you need support for depression. That might mean treatment. It might mean routine. It might mean sunlight. It might mean reaching out even when you do not feel like it. It might mean being honest with someone that you are not doing well. It might mean checking whether your life has become too isolated. If you use because you are lonely, then you need connection. And I know that is easier said than done. A lot of people in addiction are lonely, even if they know people. You can be around people and still feel alone. You can have friends and still feel unseen. You can have family and still feel like nobody really knows what is going on inside you. But sobriety usually becomes harder when you try to do it completely alone. You need people who understand. That might be a support group. It might be therapy. It might be one honest friend. It might be a recovery community. It might be someone you can call before you use, not just after. If you use because of trauma, then you need to be careful with yourself. Trauma is not just a memory. It can be a body reaction. It can be feeling unsafe when nothing obvious is happening. It can be shutting down. It can be getting angry really fast. It can be feeling numb. It can be feeling like you want to crawl out of your skin. Substances can make that feel quieter for a little while, but they usually do not heal it. They just cover it. And when you get sober, trauma symptoms can feel louder at first because the thing that was covering them is gone. That does not mean sobriety is bad for you. It means you may need actual support while your body learns a new way to feel safe. That is why it is not always helpful when people say, just stop. Of course, stopping matters. But if someone has been using substances for years to manage panic, depression, trauma, shame, or emotional pain, then stopping can feel like taking away the only tool they had. The answer is not to keep using. The answer is to build better tools. That takes time. It takes practice. It takes support. And sometimes it takes professional help. Another part of this is family history. Addiction often runs in families. Sometimes that is genetics. Sometimes it is environment. Most of the time it is probably both. Maybe you grew up around drinking. Maybe you grew up around drug use. Maybe people in your family use substances to relax, celebrate, cope, sleep, calm down, or disappear from life for a while. Maybe nobody talked about emotions directly. Maybe people drank instead. Maybe people used instead. Maybe stress was handled by yelling, avoiding, numbing, or pretending nothing happened. When you grow up around that, your brain learns what coping looks like. Even if you hated it, even if you swore you would never be like that, you can still carry pieces of the pattern. That does not mean you are doomed. It means you need to be honest about your risk. Some people can drink or use casually and walk away. Some people cannot. That is not about being better or worse. It is about how your brain, body, history, and genetics respond. If addiction runs in your family, it is worth taking seriously. Not as a reason to give up, as a reason to protect yourself. You might need stronger boundaries than other people. You might need to avoid certain environments. You might need to stop telling yourself, I should be able to handle it, because maybe casual use is not safe for you. And accepting that can be freeing. Not fun, necessarily, but freeing, because you stop trying to prove you are like everyone else. You start building a life that actually works for you. A big part of recovery is learning to be honest without being cruel to yourself. There's a difference between accountability and self-hatred. Accountability says, this is a problem and I need to deal with it. Self-hatred says, I am the problem and I am hopeless. Accountability can help you change. Self-hatred usually makes you want to escape. So if your inner voice is constantly insulting you, calling you weak, pathetic, stupid, or disgusting, that voice is not helping you recover. It may feel like you are being honest, but really you are making sobriety harder. Because when you feel worthless, using becomes tempting. Not because you do not care, but because you want relief from yourself. So part of recovery is changing how you talk to yourself. Not lying to yourself, not pretending everything is fine, just being fair. You can say, I have hurt people and I need to repair that. You can say, I have made choices that damaged my life. You can say, I cannot keep doing this. But you can also say, I am still a person. You can say, I can learn. You can say, I can get help. You can say, this pattern started somewhere and I can work on it. That is not fluff. That is practical. People recover better when they believe change is possible. Another reason sobriety feels hard is because using may have become part of your routine. It may be connected to certain times, places, people, music, shows, foods, weekends, paydays, stress, or boredom. Maybe you always smoked in the garage. Maybe you always drank while watching certain shows. Maybe you always used after work. Maybe you always got high before bed. Maybe you always drank when you cooked, cleaned, socialized, or watched sports. So when you stop, normal life can feel strange. Your brain says this is when we use. That is why changing the scene matters. You may need to rearrange furniture. You may need to stop sitting in the same spot at the same time. You may need to watch different shows. You may need to take a walk after work instead of going straight to the place where you usually used. You may need to avoid certain people for a while. You may need to skip environments where everyone is drinking or using. You may need to plan your evenings before the craving hits. This is not dramatic. It is basic strategy. If your brain has strong associations, you need to build new ones. Sobriety is not only about saying no. It is also about creating a life where saying no becomes easier. That may mean changing small things. Different route home, different drink in your hand, different evening routine, different people, different room, different music, different way to deal with stress. Those small changes can matter more than people think. Now, none of this means sobriety will feel good immediately. Sometimes people expect that once they stop using, life should quickly feel better. And sometimes it does. But sometimes, at first, life feels raw. You may feel irritable. You may feel bored. You may feel sad. You may feel restless. You may feel like you do not know what to do with yourself. You may realize you have been avoiding a lot. That does not mean you are doing it wrong. It means your brain is adjusting. It means your emotions are waking back up. It means you are learning how to live without the shortcut. That part can be uncomfortable. But uncomfortable does not mean impossible. It also does not mean permanent. The goal is not to feel amazing every day. The goal is to build a life where you do not need to constantly escape. That happens slowly. You start learning what helps. You learn which people support your recovery and which people pull you back. You learn what times of day are hardest. You learn what emotions trigger you. You learn how your body reacts to stress. You learn how to get through cravings without obeying them. A craving is uncomfortable, but it is not an order. It rises, it peaks, it passes. You do not have to solve your whole life in the middle of a craving. Sometimes you just have to delay. Take a shower, eat something, go outside, call someone, drive somewhere safe, put on a different show, go to a meeting, clean one small area, drink water, go to bed early. Do anything that gets you through the wave without using. That may sound simple, but simple things can save you in hard moments. Also, if you are physically dependent on alcohol, benzodiazepines, or certain other substances, please do not try to quit suddenly without medical advice. Withdrawal can be dangerous. Getting help from a doctor, detox center, or treatment program is not weakness. It is safety. There is no prize for suffering alone. The point is to stay alive and get better. Another thing worth saying is that recovery does not have to look perfect. Some people relapse. Some people need multiple attempts. Some people need treatment more than once. Some people do well for a while and then struggle again. That does not mean there is no hope. It means you need to learn from what happened. Instead of saying, "I ruined everything," ask, what led up to this? Was I stressed? Was I isolated? Was I around the wrong people? Was I overconfident? Was I untreated? Was I exhausted? Was I pretending I was fine? Was I trying to do recovery with no support? That information matters. Use it. Do not use relapse as proof that you cannot recover. Use it as information about what needs to change. The goal is not to hate yourself into sobriety. The goal is to understand yourself into better choices. That may sound simple, but it is a major shift, because a lot of addicts have spent years being talked down to by other people, by society, by family, by themselves. But you do not need to be degraded to get better. You need honesty. You need structure. You need support. You need responsibility. You need better coping skills. You need to stop romanticizing the thing that is hurting you. And you need to stop pretending the pain underneath does not exist. Both sides matter. You cannot only say, "I use because I am hurting," and ignore the damage. But you also cannot only say, "I am addicted," and ignore the hurt. You need the whole picture. So here is a practical place to start. Ask yourself, what does getting drunk or high give me in the moment? Be honest. Does it give you confidence, calm, sleep, numbness, escape, a sense of belonging, a break from boredom, a break from grief, a way to avoid memories, a way to avoid responsibility, a way to feel less awkward, a way to stop caring? Once you know what it gives you, ask, how else can I work toward that need without destroying myself? If it gives you calm, how can you build calm? If it gives you connection, how can you build connection? If it gives you sleep, how can you get help with sleep? If it gives you confidence, how can you build real confidence? If it gives you escape, what are you escaping from and what needs to change? These are not easy questions, but they are useful questions, and you do not have to answer them all at once. You can take one question at a time. One day at a time is a phrase people use a lot, but sometimes it is still too big. Sometimes it is 1 hour at a time. Sometimes it is one evening. Sometimes it is one craving. Sometimes it is one honest decision. And that counts. If you are early in recovery or thinking about recovery, do not expect yourself to have everything figured out. Start with honesty. Start with support. Start with safety. Start with learning your patterns. Start with asking what pain you have been trying to numb. Because sobriety feels hard for a reason. It is not just about losing a substance. It is about facing life without the thing that used to blur the edges. It is about meeting yourself clearly. That can be uncomfortable, but it can also be the start of getting your life back. Not all at once, not perfectly, but really. You are not just an addict. You are a person with a history, patterns, stress, memories, family influences, mental health needs, and habits that were built over time. And because they were built over time, new habits can be built too. You can learn different ways to cope. You can get help for what hurts. You can build routines that support sobriety. You can find people who understand. You can stop treating your pain like something you have to drown. and you can start treating it like something that needs attention. That is the pain beneath addiction. Not an excuse, not a life sentence, a place to begin. If this helped you think about your own patterns, please like this video so it can reach someone else who may need it. Subscribe for more honest and compassionate conversations about addiction, mental health, healing, and recovery. And if you feel comfortable, leave a comment with one thing that makes sobriety hard for you. Not to judge it, just to name it. Because naming the real problem is often the first step toward changing it. If this video helped you look at addiction with a little more honesty and a little less shame, please like this video so it can reach someone else who may need it. And if you want more compassionate, honest conversations about addiction, mental health, healing, and recovery, please subscribe to the channel. You are not alone in this. You are not beyond help, and you do not have to hate yourself into getting better. Thank you for being here, and I hope you come back for the next video.